Hello, this is Dr. Alex MacNeil, owner of Dr. Alex MacNeil, LLC, and producer of the podcast Mental Health Explained. I wanted to share with you a snippet of an interview I recently did with a friend of mine, Kristina Vicario, who has her own videography business. During this interview, we talk about a wide range of topics, and this clip provides good information about my private practice. If you have any questions or comments, please leave them in the comments section, or you can contact me through my website, alexmacneil.com. We're going to start with Kristina asking me about my practice.
Let's start by talking a little bit about what you do.
I'm a clinical psychologist, and that is an umbrella for a lot of different things. One of the biggest things is therapy. Therapy with kids, young adults, and family. I'm very passionate about doing family therapy. There's another thing that I'm really passionate about, which is education, which includes writing, includes being able to do a podcast, it includes so many things. Really, my goal is to be able to give people information so that they can use it to make informed decisions. But there's so much information out there that a lot of people don't know that I really think it's a passion of mine to be able to give that information, what I do know, to people. So those are really the two big things that I do within the field of clinical psychology.
That is so incredible, and it's such a paramount time for that. Who does your company serve, if you don't mind elaborating?
Absolutely. It serves the Massachusetts population primarily. Licensure, being a licensed clinical psychologist, especially for therapy, limits you to along state borders. I'm not licensed in any other state. But the residents of Massachusetts, I'm able to do telehealth for, which is wonderful. As long as a person's within the state, I could do telehealth for them. In terms of age ranges, I typically help people that are age range around 5 or 6. 5's a little young, but around 5, 6, 7 to about around 40s. But I'm able to see adults of any age range. I like seeing kids and adults for individual therapy. I'm also very passionate about family therapy. Eventually down the road, when hopefully as things, progress, I'm going to move into group therapy as well. I think also group therapy is a wonderful treatment for a lot of people, and I've had experiences doing it before, and it really does help clients out.
Right, and it sounds like you are so passionate about serving all of those different populations that you talked about.
Absolutely.
What inspired you or made you want to serve those populations? I know you talked especially about families. What is your motive behind that?
Well, one of the big things is a lot of people are going through a lot of different issues. We're talking about diagnosis. If we're talking about diagnoses and the diagnoses that I treat, anxiety, going through a lot of fear. Where does that fear come from? Depression, which is a lot of times people feel isolated, cut off, not only from other people, but from themselves, from their own views of who they should be and who they are. How can we best help that? A lot of times when we're, and other things I treat include issues that interfere with school, ADHD, learning disabilities, a lot of times behavioral issues that happen within families. These things don't happen in isolation. They don't happen in a vacuum. They involve an ecosystem. They involve the family. They involve the school. They involve the community. Incorporating those is incredibly important. So one of the big reasons why I help people the way I help people and the way I treat people and who I treat is because I can empathize with what they're going through. And I've been trained through my schooling and through my experiences to be effective in helping them.
So going deeper into your work now, what type of therapy do you do?
So there's a lot of different approaches that are really helpful, and it's all backed by science. There is a lot of different diagnoses that there are particular approaches that are really helpful. There's something called cognitive behavioral psychology, which is very helpful for a lot of diagnoses, anxiety, depression. There's also family therapy. There's different types of family therapy, structural family therapy. There's a whole array of different family therapy techniques that are helpful for treating not only the client, but also bringing in the parents, bringing in the loved ones, bringing in the people. There's something called acceptance and commitment therapy, which I manage to mention at every interview I do. This is me checking off the box. So it's acceptance and commitment therapy is wonderful style of therapy that connects people with their values and says, okay, so we understand that there are some issues going on, but what are the things that you value and how can you get closer to the things that are deep that really you feel are important in life? Mindfulness is another approach that is really helpful. And then there's also ways of conceptualizing therapy where older models really help, including dynamic work. All of those, I think the biggest thing is that it's all about what the client is coming in with, and you could tailor these different approaches to what works with them. And that's critical. It's not a one size fits all. Right. It's a what size fits for them.